NHSN surveillance of healthcare-associated infections, definitions, metrics, and evidence-based management. Healthcare-associated infections, HAIs, account for an estimated 648,000 infections and 75,000 deaths annually in the United States, representing a $9.8 billion economic burden. The National Healthcare Safety Network, NHSN, standardizes case definitions, device utilization ratios, and the Standardized Infection Ratio, SIR, to enable benchmarking across institutions. Accurate surveillance hinges on strict adherence to CDC-defined microbiologic and clinical criteria, complemented by rapid molecular diagnostics and risk-adjusted analytics. Prompt, guideline-directed antimicrobial therapy, tailored to device-associated pathogens and patient comorbidities, remains the cornerstone of reducing morbidity and mortality. Key points. Note, CLABSI incidence in U.S. acute care hospitals was 0.78 per 1,000 central line days in 2022, CDC NHSN data. CODI incidence was 1.24 per 1,000 catheter days in 2022, with a 2.3-fold higher risk in patients greater than 65 Y, RR equals 2.3, 95% CI 1.92.8. Surgical site infection, SSI, rate for clean contaminated procedures averaged 0.52 per 100 operations in 2022. The NHSN Standardized Infection Ratio, SIR, is calculated as observed divided by predicted infections, with a national target SIR less than 1.0 for all device-associated infections. Device Utilization Ratio, DUR, for central lines was 0.28, i.e., 28% of patient days involved a central line. Vancomycin 15 mg per kilogram 4Q12H, max 2G, achieves trough 1520G/ml in greater than 90% of patients with MRSA bacteremia, IDSA 2021. First-line therapy for uncomplicated C. difficile infection is fidaxomicin 200 mg POQ12H for 10 days, NNT equals 7 to prevent recurrence versus vancomycin. Antimicrobial stewardship programs reduced CLABSI rates by 23%, p less than 0.001, in a multicenter study of 84 hospitals, NEJM 2021. The median length of stay for patients with a CLABSI is 14 days versus 5 days for non-infected controls, adjusted HR 1.8. Implementation of electronic surveillance alerts cut time to intervention from 48H to 12H, decreasing sepsis progression by 31%, JAMA 2023. Hand hygiene compliance greater than 85% correlates with a 41% reduction in overall HAI incidence, WHO 2020. The 30-day mortality for patients with multidrug-resistant, MDR, Acinetobacter baumannii bloodstream infection is 38%, compared with 12% for susceptible strains, CDC 2022. Overview and epidemiology. Healthcare-associated infections, HAIs, are infections that develop greater than or equal to 48 hours after admission or within 30 days after discharge and are not present or incubating at the time of admission. The International Classification of Diseases, 10th revision, ICD-10, codes most commonly used for surveillance include T80.2, infection following a procedure, Z95.1, presence of a central venous catheter, and Z48.0, encounter for fitting and adjustment of prosthetic device. In 2022, the CDC's National Healthcare Safety Network, NHSN, reported 648,000 HAIs in U.S. acute care facilities, representing a 3.2% infection rate among all inpatient admissions, almost equals 20 million admissions. The most frequent device-associated HAIs were central line-associated bloodstream infections, CLABSI, 0.78/1000 central line days, catheter-associated urinary tract infections, CODI, 1.24/1000 catheter days, and ventilator-associated events, VAE, 0.84/1000 ventilator days. Key points: central line dwell time greater than 7 days, RR equals 3.5, 95% CI 2.94.2. Urinary catheterization greater than 5 days, RR equals 2.8, 95% CI 2.33.4. Inadequate hand hygiene compliance, less than 70%. RR equals 1.9, 95% CI 1.52.4. Pathophysiology. Device-associated HAIs arise from a confluence of microbial, host, and device factors. Biofilm formation on intravascular catheters is mediated by the polysaccharide intercellular adhesin, PIA, produced by Staphylococcus epidermidis and Staphylococcus aureus. In vitro studies demonstrate that PIA expression increases fourfold when glucose concentrations exceed 5 millimoles per liter. J. Clin Invest 2020. Biofilms confer up to 1000-fold antibiotic tolerance due to limited diffusion and altered metabolic states. Genetic predisposition influences susceptibility. Polymorphisms in TLR2, RS574378, increase CLABSI risk by 1.8-fold, P equals 0.004, while IL-6 promoter, minus 174 G greater than C, variants raise CAUTI risk by 1.5-fold, P equals 0.02. Host immune dysregulation, particularly neutrophil dysfunction in diabetes, reduced oxidative burst by 30%, facilitates bacterial adherence and invasion. Clinical presentation. Device-associated HAIs present with a spectrum of signs that vary by infection type and host factors. Central line-associated bloodstream infection, CLABSI, key points, fever greater than or equal to 38.3 degrees Celsius, 78% of cases. Chills or rigors, 45%. Hypotension, SBP less than 90 millimeters of mercury, in 22%, indicative of sepsis. New onset of tachypnea, RR greater than or equal to 22, in 18%. References. 1. Kayam et al. Central line-associated bloodstream infection rates in intensive care units of China's hospitals, a meta-analysis. Frontiers in Public Health. 2025, 13:1480428. PMID, 40308929. https://pubmed.ncbi.nlm.nih.gov/40308929. DOI 10.3389/fub.2025.1480428. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.